So we're going to be talking about progressive supranuclear palsy, also known as PSP. As the name implies, it is a progressive disorder of the elderly. It's supranuclear, and what that means is we can overcome the ophthalmoplegia with the doll's head maneuver, and it's a palsy that's usually bilateral and symmetric. And the key and differentiating feature is the down gaze palsy. So as you know, elderly patients often have difficulty looking up, and it becomes progressively, slowly worse. You should not use the up gaze palsy to determine PSP, because that up gaze palsy can be just normal in older people. But in down gaze palsy, if you ever see this, especially in someone who has either Parkinson's disease or Parkinsonism or Parkinson's that's not responding to medical therapy, those are the big red flags that it might not be Parkinson's disease and it might be PSP instead. And in patients with PSP, they're going to have similar features to the Parkinson's patients. They're going to have decreased blinking, and they're going to have masked facies. And that's why it's often confused with Parkinson's disease, because it has similar features in terms of the neurodegenerative component. The main thing about PSP is the down gaze palsy can be overcome with the doll's head maneuver. So just by moving the head passively, we can get the eyes to move down, which means it's not myasthenia, it's not neurogenic from a cranial nerve palsy, it's not infranuclear in terms of muscle or nerve. It is a supranuclear palsy if we can overcome it with the doll's head. So for ophthalmologists, the main thing not to give down gaze palsy patients, but especially patients who have PSP, is we want to have single vision readers, which are glasses just for near or just for distance, because they can't use the bifocal. And we want to bring all their world up, either with a little table for eating or reading material, so that they don't have to look down. So by eliminating the need to look down, you can really help people with PSP, because PSP doesn't have any cure. So even though there are treatments, there are no good treatments for PSP. So the main thing is recognizing that a down gaze palsy is not seen in Parkinson's disease. If you see this down gaze palsy, we're going to try and confirm if it's supranuclear by using the doll's head maneuver. Once you've made the diagnosis of PSP, we're going to communicate that information to neurology. And please don't give them bifocals or trifocals or progressives. They need to have single vision glasses and bring their world up so they don't have to look down.